So to get started, tell me, Dr. McKnight, are you ready for me to, okay, it looks like it's recording. Great. Okay, so tell me what you know about WIC, if anything.
I don't know too much about WIC, I suppose. I guess I know that it provides like an organization that I think provides, resources to local families. I know, I guess from when I worked with it in the past, it was like a lot of women and children to help provide them with access to like nutritious foods and supplies that they need for at home.
Awesome. Yes, you're right. So WIC is a supplemental nutrition program for women, infants, and children, and it has actually been around since the 70s. So it's pretty well known. Most of our participants learn about WIC through word of mouth. So it could be friends, family members. They may have been on WIC themselves at some point when they were younger. Or a lot of our community partners obviously know about WIC and are recommending it to others. So it is a supplemental nutrition program, as I mentioned, for women, infants, and children. So the categories of individuals that are eligible for WIC would be at any point during pregnancy. So as soon as someone finds out they're pregnant, they can contact WIC and enroll in the program. We do not require proof of pregnancy, so they do not have to have anything written out from their physician or anything. They can come in as soon as they find out. The other category, infants. So as soon as the infant is born, ideally mom is on during her pregnancy, and we just let her know to call us when baby's born. But they can come in as soon as they're born. And then for children, we cover from birth all the way until they turn 5 is how long they can be on the program. So a lot of times people think about WIC as the place to come and get formula, but the benefits actually go much longer than that. So we want to make sure that people know that they can actually stay on WIC until they turn 5.
Okay.
So in order to qualify, somebody needs to be in one of those categories, women, infants, or children. They also have to have been, or they also have to reside in the state of Illinois. So we require proof of address, and that's just confirming that they live in Illinois. As far as county, we encourage that participants go to the county that they reside in, but that's not a requirement. So if it's easier for somebody to get to the Peoria office versus East Peoria, we can certainly take those clients. We recommend that they try to go to their office when possible, just because that affects caseload. So each county has an assigned caseload, and so we don't want to, take clients from another county. But certainly, if transportation is a barrier, or for whatever reason they have a preference, we'll gladly take any clients as long as they do live in Illinois. And then the other requirement is that somebody is income eligible. So our program is income based. Somebody needs to be at or below a certain income level in order to qualify. And a quick way to tell if somebody is eligible, if they receive the link card or Title 19 medical card, that's an automatic eligibility. So if that's the case, we can simply look that up using the websites for either link or the medical card. They don't even need to bring in proof of their income. They wouldn't need to bring paycheck stubs or anything like that, just their ID, and they would need to know their link number so we could get into the link website to confirm that. But if somebody does not have either of those programs, that certainly does not mean that they're not eligible for WIC. Because our income guidelines are actually a little higher, somebody may not qualify for link or Title 19 and still be able to get WIC. So we will, in that case, ask for proof of income for whoever in the household is bringing in income at that point. And usually that's paycheck stubs. If somebody does not have official check stubs, we can even take like a handwritten letter from an employer. So we have a variety of things that we can use for proof of income and ID, as well as address. But those are the 3 requirements for the program. And then part of the WIC program, an individual has to have some type of nutrition risk. So that is where our nutrition assessment comes in. We have 6 nutritionists on staff here in Peoria County, and those nutritionists will have an in-depth conversation with the client to determine what that nutrition risk is. We've never turned somebody away for not having a nutrition risk because there's always something. Some common ones we see, like excessive sweetened beverages, maybe high or low weight gain during pregnancy or infancy and childhood as well. Nutrition risk factors. So for children, it could be choking hazards. Infants, it could be like inappropriate formula mixing or leaving formula out too long. For pregnant women, we ask about the risk of listeria and all sorts of different risk factors there could be. We also test iron here at WIC. We do a hemoglobin finger check. So with that, a lot of times low iron could be a risk factor as well. So there's a number of things that we cover and address to determine what that nutrition risk factor is. And then after determining that risk, we will complete the nutrition education based on that participant's needs. One thing that the state is very adamant and all of our nutritionists have to go through training on is participant-centered counseling. So we want to make sure that that conversation with the WIC participant is very participant focused. If their major concern right then is not sure how they're going to continue to have enough food in the fridge, then our focus will be on food insecurity and connecting them to resources and making sure they really know how to stretch that food dollar. Versus, somebody else may not voice food insecurity, but they may have a really picky eater and they just are very frustrated and can't get through this picky eating. So maybe that will be the focus for that person. So we really try to have it very participant focused. And at the end of each visit, we try to come up with a goal with the participant, whatever they feel that they can work on so that we can then address that goal at the next visit. So part of how the WIC visits work, normally I'll walk you through a traditional visit compared to what we're doing in response to COVID-19. But currently, or I'm sorry, pre-COVID-19, a participant would come into the office either at a scheduled appointment time or during walk-in hours. We did walk-ins every day, so somebody could come in anytime they wanted to, or they could schedule an appointment if they'd like, and be checked in at the front desk. And then we would look at that proof of income, proof of ID, proof of address, and get them entered into the system or get everything updated before calling them back to talk with a nutritionist. We have 5 clinic rooms here. So our nutritionist would then call them into a clinic room where they would complete the height, the weight, the iron check if needed, and then the whole nutritionist visit. So they would talk through all that stuff, provide any handouts, answer any questions, and then assign a food package for that individual. And then they would be given a WIC EBT card with those foods on there before they schedule their appointment and then their next appointment and then leave the office. So it could really get done all in one day. Walk-in hours went really well. We would typically be busiest between like 10 and 2, but it was never unmanageable. I mean, we were able to do just fine. And then COVID happened and everything had to change, as with everyone else. So the state issued a physical presence waiver that allowed for us to complete the visits over the phone. Prior to that, we have a requirement that we had to see the actual WIC participant in person at minimum every 6 months. So when they were first born, they would come in. 3 months later, we would do a nutrition education with the parent. And then 3 months after that, we would have to physically see the child again to do another height and weight. So then when the physical presence waiver happened, we no longer had that requirement, meaning that we weren't able to do any heights or weights in person, none of our iron checks. We just had to have conversations over the phone and ask for any measurements that might have come from a doctor, from like a well visit check or any recent doctor visit. So now we schedule appointments. Like if a client calls in and says, I'd like to sign up for WIC, we will look at the next available time, schedule them an appointment in the system, and our staff will just call them at that time. So our frontline staff will still open up the visit and ask for the proof of ID, proof of address, like ask what type of documents they have for those things, and then document what they say that they have. And then the call will get shifted to a nutritionist, and the nutritionist will just complete everything over the phone. And then the client will have to come in. If they've never come into WIC before, they'll have to come into the office just to show those proof of documentations and pick up their WIC EBT card. So after they have that WIC EBT card, the benefit now is that we can load that over the phone. So they come in for that initial visit, we can issue up to 3 months of benefits for them. And then when they come back in 3 months, which normally would have been in office, now we can do that nutrition education visit over the phone and then just issue the benefits right to the card. So we only have to check that documentation, like the proof of address, proof of ID, proof of income, annually at that certification visit. So the certification happens, it's good for 1 year, and then the state requires those education visits in between every 3 months. So that's why we see them more often, but the actual certification is good, so we don't need to reassess income or anything for an entire year. So it's really not a huge time commitment for the participant. Even when they are coming into the office, the child really only has to come in 3 or 4 times a year. Or I'm sorry, the child really has to come in 2 times a year, every 6 months. The parent would just be in every 3 months. But now with the physical presence waiver, they really could come in just once a year for that certification visit if they wanted to. Our physical presence waiver right now is through mid-April. So if everything continues as is, that'll end mid-April and we'll start resuming our in-person visits, or that could get extended, who knows. We did try to start back up on in-person visits. We just gave it an option. So we weren't requiring anybody to come in person, but if they wanted to, which a lot of people did want to get those heights and weights and iron check and just talk face to face, we gave that option. And then that was right before like the Delta variant and then high transmission. So then we had to walk that back. And now we're really doing everything over the phone. The exception would be if we have somebody who's hearing impaired or has difficulty using a phone, or if they don't have access to a phone, we'll certainly accommodate and bring them in office. And we just keep it to a shorter visit to minimize that contact time. But hopefully, there's certainly positives and negatives to going virtual and doing things remote. But there's so much benefit to face-to-face. We can see that interaction between the child and parent, and even, how the car seat looks, for example. We have 2 car seat technicians in our office. So if a parent comes in and maybe the baby's wearing a coat in a car seat, or we see that the car seat's not strapped very tightly, or the child's too large for the car seat, we are equipped to assess that sort of thing and check for safety things. So there is a lot of benefit to seeing firsthand how things are going, but doing our best over the phone and making the most of that. I'm going to go over. Do you have any questions so far on anything with WIC?
I guess so. After the child turns 5, that child is no longer eligible for WIC, but the mom could still get benefits if she, were pregnant with another child or whatever. So that first child, can they go then to like food stamps or other ways to help kind of provide nutritious food, I guess? Or what do you guys kind of recommend for when a child ages out?
Yeah, absolutely. So typically around that age is when they are starting kindergarten or about to start kindergarten, or maybe an early head start.
Right.
So a lot of times they do get like breakfast and lunch with those programs or with the school. But certainly the link card is perfectly fine, and participants can have both. It's not like it's either or. So most of our participants actually would have the link card, which is based on the amount of money on that card is based on the number of individuals in the home.
Okay.
And so we do, yeah, we can certainly get somebody connected with information on how to get a link card if they don't have one yet. But that's a big one. And then we just remind that WIC is supplemental. So the foods on WIC are not intended to cover everything that that person needs, but really just supplement their diet with healthy foods and kind of the basics and the staples. So the foods that would come on their WIC card would be milk, eggs, beans, peanut butter, their choice of grain. So they have the option if they want to get rice, corn tortillas, oatmeal, bread, buns, whole wheat pasta, whatever type of grain. Then they would get cereal, and the WIC cereal even is pretty specific. So there's maybe 10 to 15 different types of cereal they can choose from. And they all have to be low enough in sugar, high enough in fiber to meet like the WIC guidelines for which cereals are approved. And then we have juice that has to be 100% juice. And then we have a cash value amount of fruits and vegetables that they can buy fresh, frozen, or canned. And then, of course, formulas on WIC for children under age 1. And then once they turn 1, they switch over to the whole milk. And then once they turn 2, it goes to 1% or skim milk. So the WIC foods are very specific, whereas the link card is a cash value amount for them to choose whatever they would like to. So we use that as kind of an education tool of why these specific foods are on here and how these foods can help improve your diet. But yes, that's a good question. So once they turn 5, again, typically it's around the school age, so they're getting a couple meals provided from school or Head Start programs, and then the link card can help supplement that as well. And we do, that kind of brings me to a good point as far as referrals. So we really want to assess the needs of that family. So one of the questions we ask is, do you often run out of food at the end of the month? And if the answer is yes, we have a food pantry network in the area that we will refer that person to, and they'll get a list of different food pantries, when those pantries are, and how to access that food as well. So that's one of the referrals we make, but there is a number of other referrals that we can make as well. We are currently utilizing a system called IRIS. It's an integrated referral system. There are a number of community partners involved in IRIS now. We've had it about 2 years now. Frequently, we refer to home visitors. So if we have a pregnant mom or newly postpartum mom that could benefit from home visiting services, we will make a referral and get them connected with one of those. We also have a referral for perinatal mood disorder. So if mom maybe has some anxiety or depression prenatally, or some postpartum depression, we can get her connected with some people to help support her during that. And then we have like early childhood screenings. So if a mom is concerned about developmental delays or anything, and hasn't mentioned it to her doctor or doesn't have an appointment coming up or something, we can refer her directly to Child and Family Connections for developmental screenings with them. What other referrals? We have like Safe from the Center for Prevention of Abuse. So if there's any kind of, obviously, like domestic abuse or anything like that happening, we have an easy referral source for that. We're also mandated reporters. We have an obligation to report anything that's going on for an investigation. But yeah, a number of referrals. And then, of course, if we talk to moms prenatally and they have not been connected with an OB yet, we have a list of providers in the area that we give them to try to get them connected and get them prenatal services. And then pediatrician, if we sometimes have participants that move to the area and WIC is one of the first places they go to get their benefits continued, we'll connect them with a list of pediatricians in the area as well. Any other questions so far?
I guess not really so far. I guess the only other question I had was what I'm assuming is if, I'm ever interacting with patients who I think would benefit from this, would I just, tell them to reach out to the health department? And like the closest one to them, I guess, is kind of where to start, just like the health department in general.
Yeah, that's a great point. So we do not need any kind of specific referral form or anything. We do have forms that we've sent out like to both hospitals and just area offices as kind of a referral form where you can put their height and weight and any recent measurements or labs and send that in, and then we will call the participant as kind of a, I guess, a warmer handoff instead of just handing them a phone number. But they can certainly, if it's their preference, just walk right into the health department. Even now, when we're not doing in-person visits, if somebody doesn't have access to a phone or they just prefer to come in person, they can walk in still in person. We will just complete the most of the visit over the phone. So they'll walk in, we'll just give them an appointment time, make sure they're eligible, and say, okay, somebody will call you at this time and we'll get everything complete then.
Sounds good.
But most of the WIC, so WIC is a national program, so each state rolls it out slightly different. We all have the same basic guidelines, but you would see different states may have a little bit different, for example, food packages or slightly different policy and procedures, but the overall idea is the same. It's a supplemental nutrition program that nutrition education is a required component. And then within each state, each county follows the same set of policies and procedures that state lays out. And most of the time, the WIC office is located right in the health department. So it's a federally funded grant program, and it's primarily run through health departments. I think the exception would be up in Chicago. Because they have so many offices, theirs is called CEDA, C-E-D-A, and they have WIC offices through that. But most of the time, in the rest of the state of Illinois, at least, the WIC offices are located either within the health department or at like a satellite clinic. So Tazewell County, for example, their health department is pretty far out of town. So they partner with the Head Start program, and they have a satellite clinic at the Head Start office where they go like one day a week so that they can be in that more central location. But a first start, at least, to find out where the office is and what the hours would definitely be at the health department. What was I going to say about the visit? Went over referrals. So the main real part of the WIC visit, in conjunction with our physician offices, is we just try to supplement those visits. So obviously supplement with foods, but the things that maybe the participant doesn't remember to mention or feels like they don't have time to mention. So their physician visit is obviously much more medically focused. So we're talking about specific medical things, developmental things. And then here at WIC, we can really focus on that nutrition piece. So tips for picky eating, recipes, the importance of taking prenatal vitamin, any of those nutrition things that, again, that the participant may not think to cover at the physician visit. And we work closely with like Unity Point, their lactation department, as well as the OSF Breastfeeding Resource Center, to try to be a consistent message with breastfeeding and then consistent support, so that when that person is at their prenatal visits, they're getting the same message at their WIC visits. And then when they have the baby and they're in the postpartum unit and they have that lactation support at the hospital, typically lactation will fax us a referral for somebody that they know that is on WIC and let our breastfeeding peer counselor know, so that we can reach out to them and make sure that they have that continued care, and that those first few days at home, they feel like, okay, now that I'm home from the hospital, what do I do? And we try to be that support to keep them connected and follow up and make sure that they're going to their postnatal and the new baby visits. And that brings me to the breastfeeding piece. So I mentioned at WIC we have 6 nutritionists. Of those nutritionists right now, I have 2 on staff that are also certified lactation specialists. and we'll likely have more of them go through that training as well. And then we also in our office have 2 breastfeeding peer counselors. So that peer counselor role is really unique in that in order to qualify for that position, the person has to have been on the WIC program themselves, and they also have to have breastfed within the past 5 years of their hire date. So their role is really, not to be that breastfeeding expert, not the one that's going to diagnose mastitis and go through all of that, but really to be that support person and that check-in and that kind of go-to person when mom just needs a little support. So our peer counselors will check in with every mom during their pregnancy and just talk about their plans. Maybe mom says, I definitely don't want to breastfeed. I have no interest in breastfeeding. We will just let them know we're here if you need us. If anything changes, you change your mind, just know that we have breastfeeding support available and can help you get a pump or whatever. And then we have some moms that are like, well, I think I'll try it in the hospital, but maybe their goal is 2 days or something. And then we have moms that are like, yes, I want to breastfeed the whole year. And, so we have peer counselors to go through all of those concerns and those things that might come up. And they'll check in with each mom at some point during pregnancy. And then again, during that 9th month of pregnancy, when we're getting closer and going through more specifics on what to expect, and here's how to get breastfeeding off to a good start. And then we also try to check in with every mom 2 times in that first week postpartum. And that's if we know that they've delivered. So that's where those referrals from the hospital come in handy, is letting us know that mom has delivered so that we can follow up and see if she has any needs, any concerns, or any way that we can support. A lot of the support from peer counselors will be moms who feel like they don't have a good enough supply. That's such a common concern. We hear moms that are just like, well, I tried, but baby wasn't getting enough. So then I supplemented and then supply starts to go down. So they go over signs to tell the baby's getting enough to eat and just kind of reinforce that, you are making enough, baby's doing great, and that type of thing. And then going back to work or school is another one that our peer counselors really help out a lot with. So we keep breast pumps here at the health department that we can give to parents. We have a number of pumps that are pumps that person would keep. So with the medical card, they cover 1 pump every 5 years. With most other private insurance, it's 1 pump every pregnancy. So we keep the pumps, we work with a supplier and keep the pumps here and fill out all the paperwork so that person doesn't have to do that on their own and wait for the pump to get there. They can some will even come straight here after the hospital to pick up their pump. If somebody maybe got a pump 3 years ago, but it doesn't work anymore, or they gave it away, or they can't find it, we do have a number of hospital grade loaner pumps that we can loan out for people to borrow as long as they need to. And then we keep a number of hand pumps here as well if somebody just needs a hand pump to get them through for a little while. So that's another common way that we support, is through those pumps. And just kind of to check in, people will ask, all sorts of questions like, one side seems to be bigger than the other. My baby has a preference of one side. My baby's falling asleep every time. My baby is hungry after an hour, like all sorts of those new mom questions. Both of our peer counselors have a work cell phone so that the client can just text them anytime. So if, something comes up and they maybe they're tired or just have a lot going on, and it's just easier to text and wait for a reply than talking on the phone to somebody. So we try to accommodate as much as we can with that. So we have a big breastfeeding component. We try to be very breastfeeding friendly and breastfeeding supportive without being like anti-formula. So we really encourage mom to make the right decision for her and her family. And we have formula here if you need any. If your goal is to breastfeed, we also have support here to help you breastfeed. So we want to try to move away from thinking as WIC is the place to come get formula, and instead be more all-encompassing of this is where you get supplemental foods and support and nutrition education, and lots of breastfeeding support if you need it. So yeah, we certainly do that. But the state has rules on our breastfeeding support, and we cannot have any formula products in the office. So we never keep formula on hand here. It only comes in the form of the person's WIC EBT card. And then we can't have any like formula stickers or posters or anything like that. We have a very breastfeeding friendly environment here. We also are a milk depot. So that means that we partner with a milk bank. The one that we use is the Mother's Milk Bank of the Western Great Lakes. And so if a mom has extra milk, she can bring that in and donate it. So she would get a donor number. She'd go through the milk bank to get a donor number and drop off her milk here. And then we overnight it to the milk bank, and they will test it to make sure that it's safe and then send it out to, they try to keep it as local as possible. So most of the milk collected here would go to OSF or Unity Point. And that milk would go to babies. Maybe they're born premature and mom does not have milk in yet or not have enough milk to feed them, or maybe baby is only tolerating breast milk and the mom is not able to breastfeed for whatever reason. So there's a number of reasons that supplemental milk can really help a lot of babies in need. So that's pretty cool. We've been doing that since 2017, and we have over 10,000 ounces donated now. So it's been really awesome. We even had a mom of twins that was still producing and nursing well at about a year and donated a ton of breast milk to us. So it's much better than somebody having a freezer full and letting it go bad and having to throw it away, after all that, all the work and time that they put into nursing. Just to know that it's going to a good place. So yeah, so that any kind of breastfeeding support, we're here for that. And we work really closely with both hospitals. We also, myself and our peer counselors, are part of the Central Illinois Breastfeeding Task Force. So a number of providers and then moms in the community are involved in that, just to try to promote consistent messaging and support throughout the community. So we will look at like breastfeeding spaces and trying to help improve breastfeeding spaces. If somebody has any issues with an employer or place of business, we'll contact them and try to work through any questions they may have on how to support their employers to have a more breastfeeding friendly space. And then at our health department, we are involved with Illinois State Physical Activity and Nutrition Grant, and that has a breastfeeding component as well. That we're a part of, again, to just improve the overall breastfeeding supportive spaces in the community. The other things that we are involved with in our department, kind of outside of WIC, at our health department, we partner with Woodford County and Tazewell County as a tri-county initiative, and we have a community health improvement plan that is based on our needs assessment. So we'll do a needs assessment in the community and see what areas of concern there are, and then develop a response to that in the form of our community health improvement plan. And currently that plan includes an area with healthy eating, active living. So I sit on that committee as well. And we just look at healthy eating and active living in youth and adults, and how we can, as a tri-county, support efforts to improve that. So we look at breastfeeding is actually a piece of that plan, as well as access to physical activity and nutrition, so food insecurity and transportation even, and different things like that. What else? Any questions or anything that you have either about WIC or about nutrition at the health department?
Not right now. I think that was all like really good info. I didn't know all of that about like the breast milk donation and all that. So that's really good to know, and that's cool. So
yeah, so the same milk bank, OSF Breastfeeding Resource Center partners with them as well. So it's nice that there's at least 2 drop-off locations here at the health department, and then the breastfeeding resource center is kind of North Peoria. So depending on location, it all goes to the same place, so people can donate whichever location is easiest for them.
And that is something that's more local to this program, or is that pretty common of WIC nationwide? Do you know?
So that's just specific to our agency. We really had heard about the milk bank, and our peer counselor really thought it would be a benefit to our area. So we worked with them to make it happen here, and it is happening at more places. I keep hearing about more health departments that have milk depots now. And I know the resource center at OSF is also trying to become, I don't know what the exact term is, but basically like a milk dispensary, so that they can collect milk, but then also give milk to people that need it. So that's a little bit more, you have to have a little bit more specifics on that. But I know that they're working towards that right now. So until then, somebody would have to go through either the hospital if it's early on postpartum, or they could reach out to the Mother's Milk Bank of the Western Great Lakes directly and see about that. I know if a child has a certain medical condition, it could be covered, the milk could be covered either by the medical card or their insurance. But if it's just preference, I don't think that it's covered. And I know it is very pricey. It's much more pricier than formula to actually purchase human milk. So more work to be done in that area. I will send you an email and provide our WIC prescription form. So that'll give a list of all the different formulas we have. And then the WIC formulary will be the same thing. It'll give you a list of the prescription or the formulas that we have. And then I'll also give you a chart of our income guidelines that show for how many individuals in the home, this is how much money somebody can make up to that point. And that'll have my contact info so that if you do have any questions or anything comes up, you can reach out at any point.
Sounds good. Thank you so much. This is very, very helpful.
Good. I wish that you could have been in the office and gone through a client visit and all that stuff, but we have nothing happening in our office right now. So hopefully at some point in the future, you can come stop by and see the office.
Yeah, definitely. Sounds good. Thank you.
All right. Thanks, Emily. Just reach out if you ever have any questions.
Perfect. Will do.
All right. Have a good afternoon.